Hope everyone's doing well. This is Dr. Bijoor. I'm a board certified family physician with additional board certification in obesity medicine and lifestyle medicine. I wanted to just hop on here real quick to explain what obesity is and how it is important to manage it, how and why. So obesity is defined as a medical condition, a chronic medical condition, where the body mass index of the individual is over 27 if the individual has other comorbidities like type 2 diabetes, hypertension, hypercholesterolemia, or heart disease, and BMI of over 30 without any of those other conditions. So what that means is when we manage obesity, we manage it just like any other medical condition. And this is really important when it comes to stigma associated with obesity and obesity treatments, which I see a lot. And I just want to highlight that a little bit. There are some very good medications out there to address obesity and to get your health back on track. It's important to do this because anti-obesity medications have been shown to reduce the incidence of major adverse cardiac events. What does that mean? It has been known to reduce the risk of heart attacks, strokes, and also other comorbidities and bad outcomes there. Now, we know obesity is related to cancer, right? Obesity is related to heart disease. Obesity is related to a lot of chronic mental health conditions, anxiety and depression. So it is one of those medical conditions that if we address the root source of it or the root cause, and you have a good clinical team on your side, a good physician knowledgeable in managing obesity, you can really get back to your healthy weight. And that translates into many other things in your life. Healthy mood, just empowers you to practice healthy habits in your daily life. Your children start eating healthier. It just has a ripple effect on everything else. So to think about obesity as any other medical condition, if you had a sinus infection and your face was stopped up, your face was hurting, what would you do? Go to the doctor, get an antibiotic, take the antibiotic for 10 days or so and get better and get back on with your life. If you had a chronic condition like hypertension, and no matter what you did, like eat healthy, exercise, your blood pressure still stayed up, it would be time to start a medication as another tool to help manage your condition, right? So likewise in obesity, when you are eating well and you're exercising and you're doing all the things right and your weight is just not budging, it's not you that's doing it, okay? Obesity is a neuroendocrine gut disconnect. I want you to really clearly understand this. There is a dyssynchrony between the brain receptors, and there are many of the brain receptors that control our appetite, how hungry we are, how full we feel, and that is also cued in by our dopamine system, amygdala. There's a whole lot of neurobiology in obesity when it comes to managing that. But if we're able to manage obesity and get your weight back on track, reduce the excess body fat, gain lean body mass, not only do you prevent a whole host of other conditions, just like, if you had a pneumonia, you'd get an antibiotic to prevent from going into respiratory distress, like that. Obesity, if we address it with the appropriate medications, which are FDA approved, evidence-based, alongside with your lifestyle modification, it's a great thing. And I see great outcomes. I see a lot of patients with obesity, a lot of people that have tried everything. Unfortunately, the stigma is still around for obesity. 60% of our United States population has either obesity or is overweight. So it's really important we address this well. We have a lot of management tools in our toolkit, and it's about time, if you are struggling with obesity, struggling with any of the other factors that have happened as a result of obesity, that you address it with your physician and at least gain the knowledge of what are the tools out there, and have a healthy, happy life. Thank you.